Well, thank you again to everybody, and I also welcome Dr. Ron Glatz. He is the initiator of this event here. He is in the back. Would you like to stand up for a moment, please, Doctor? I said I couldn't do it. I mean, if I have anything to do with bureaucracy, I think I wouldn't have even passed my examination, my final, if I didn't have a woman in my group, and she made sure that I got all my papers. Dr. Glatz has put up one very important question here, which I want to pick up right away. It is the fact that some of you, or I don't know how many, may think that this is a subjective method when you test the pulse, the so-called pulse testing. Before I tell you in a minute what's that all about, if you ever want to go into healing or into medical practice, you would find yourself searching for a method that is beyond conventional medicine, because 80% is chronic, and conventional medicine, unfortunately, as you all know, doesn't have answers for these things. If you start kinesiology, you're welcome. Take about several years to learn to be a real professional kinesiologist. If you want to do electroacupuncture, you're welcome. You need at least half a year if you really practice in order to become competent. If you want to go into reflexology or iridology, it takes some time to study that. If you want to go into homeopathy, you may need all your life to study that. This here is so simple that I always quote Henry Thoreau, simplify, simplify, simplify. It is a genius invention, and what you test, you don't test the pulse, you test the reaction. When I say, Jim, do you feel this? Do you feel it? Yes. It is a touch. You get touched. There's a reaction. Everybody feels it. Everybody feels a reaction. If you scroll, some people start out when they want to find a frequency, they scroll like this. You don't have to do that. You just scroll through it and you will find a reaction. So Ron said, Dr. Glatz said, why don't you have an automated system? Well, I said, because we do not have an automated system to take a stethoscope to listen to the heart murmur or to palpate the liver. There are certain things that you just have to put hands on the patient. Unfortunately, many therapists want to walk away from the patient. They don't even want to touch the patient anymore. All you have to do, and as a therapist and doctor, I think you will comprehend after one half day to find the pulse. That's all you have to do. You have to find it. If you have the pulse, you will feel a reaction. It's very simple. Very simple. We had 20 nurses in our clinic. They all are capable to do it. And we have reduced it now since I'm 63. We have 12 now. They can all do it. And I have trained numerous doctors and therapists all over the world. They come to our clinic for training, and we have given seminars in New York. We'll give the third one now, 19th and 20th of June. Now, I always focus upon the practical aspects behind a successful anti-aging clinic. You see, this here is designed to make you stable, to make you competent, to build up integrity, so that you build up an identity before your patient. When the patient comes to you, the patient has no clue what's going on. But the problem is, and I know what I'm talking about as a doctor for 35 years, the doctor knows even less. And so the doctor first must get guidance. And I have been looking for a method for decades that could give me guidance, standardized, fast, swift, and reproducible. A reaction is a reaction, and everybody could feel a reaction. So, when we have a patient, I don't ask the patient what the patient has. I always say, don't tell us anything, and we will demonstrate it in a little while here. We'll have one volunteer. Who was the volunteer? There was one lady. Yes. Mrs. Tao from Taiwan? Yes. And we will not ask her what her problem is. We'll find it out. You don't tell us anything. You will be silent like a grave. Dr. Ron Glatz asked me, they say they don't know how this works. Of course, we know how this works. And I just want to, for 2-3 minutes, just repeat the essence of it, because you have such a tight schedule here. One thing for sure is, again, when you have a patient with osteoporotic pain, and the pain ceases after a few sittings with specific fields, if you change the fields, you will not have success with it. You need a specific field. We have tried it several times. When you have success with that osteoporotic patient, or you have success with numerous other health disorders like tinnitus or colitis or anxiety disorders or fibromyalgia or back problem or tooth problems, you want an explanation, and you want to tell your patient or anybody, any doctor, what is going on. And the key is the same principle as in the MRI. When you study the MRI, you immediately find the name Sir Joseph Larmor. That's his name. 1857 to 1942. Irish physicist and mathematician. Sir Larmor was instrumental. He found out when you have a magnetic field, you see our organs, as I told you, are composed of hydrogen atoms. Mostly water. It's hydrogen. These hydrogens are little magnets. The hydrogens represent a magnetic field, and that's what we use in the MRI for imaging, this magnetic field. We even manipulate the magnetic field with another huge magnet, and we condense these little magnets by rolling the patient into this huge magnet. So we play with those little magnets. But if you have a magnetic field and you expose these hydrogens in the organ to another field, to another external field, the atoms, the little magnets, the hydrogen magnets, will start precessing, rotating around the axis of the external field with a special frequency, the Larmor frequency. The Larmor frequency is called Larmor because he could arithmetically find out that this frequency varies from tissue to tissue, and that's why you get different images from the liver, from the heart, when you do the MRI. The frequency, the spin of the hydrogens varies because per se the hydrogens would have all the same spinning velocity.